Hi everybody and welcome to our video series on basics of MSK physical exam. A tiny disclaimer, these videos aim to complement the content seen in class and thus are not meant to replace any didactic material. Nonetheless, enjoy the watch. Let's first look at tests for meniscal injuries. The Tessely test is the first one we usually do. Pain provocation at this maneuver usually indicates a meniscal injury. Keep in mind though that other conditions at the knee might provoke pain during this test. Using a Tessely in conjunction with other tests might help you further confirm your suspicion. The Apley and the McMurray are good examples of such tests. Both are maneuvers that apply compressive and shearing forces on the meniscus. Pain provocation at these two maneuvers indicate an underlying meniscal injury. These two can be very irritating for your patients and thus might bias the rest of your encounter. Use them wisely. The Apley test also has a distraction component, as shown here, to differentiate meniscal from ligamentous injuries. When a patient comes with lateral knee pain, the distal IT band might be in cause. The Nobles test will help you elicit pain related to friction between the lateral femoral condyle and the IT band. Repeating the movement will help confirm your suspicion. The anterior cruciate ligament is one that is commonly injured in the knee. The anterior drawer test is a specific and sensitive way to assess it. It is done by sliding anteriorly the tibia with the knee at 90 degrees while stabilizing the foot. Pain reproduction indicates a partial tear, while increased range of motion might suggest a partial or complete tear. Keep in mind that the most painful tears are grade 2 tears, because some fibers are still holding and are still innervated. A complete tear or grade 3 is initially less painful, but is usually accompanied by rapid and important swelling in the knee. The Lachman is another ACL test that evaluates mostly the same aspects. It is done with more velocity. While assessing a normal knee, you should feel a firm stop and a characteristic knock at the end of the motion. Again, pain or increased range of motion compared to the healthy side are indicative of an ACL tear. What is currently shown here is an alternative way to assess the ACL. These are tricky tests to do and only practice will make you more confident. The posterior drawer test is similar to the anterior drawer one, except that it evaluates the posterior cruciate ligament. It is done by sliding posteriorly the tibia with the knee at 90 degrees while stabilizing the foot. Pain reproduction indicates a partial tear, while increased range of motion might suggest partial or complete tear. To confirm a suspicion of medial collateral ligament injury, the most sensitive and specific physical exam maneuver is the valgus test. The goal is to apply forces that will create a gap on the medial aspect of the knee and thus pulling on the two extremities of the MCL. Pain or increased range of motion compared to the healthy side are indicative of a MCL tear. The same principle is applied for the lateral collateral ligament with the varus test. The range of motion is physiologically increased compared to the valgus test. Keep that in mind so you don't get confused and led to a false diagnosis. The end of motion should be firm and abrupt, similar to what is found in a normal knee while doing the Lachman. Again, practicing with somebody is advised to make sure you are confident while doing these tests. This marks the end of our short video. Feel free to contact us for any suggestions or comments. Thanks for watching.